So myositis is becoming a more commonly recognized symptom. How do you make sure that there is not a cardiac component? So cardiac myositis has gotten more attention since the publication of the New England Journal of Medicine case reports in 2016. This was a publication that highlighted 2 patients who developed fulminant myocarditis on combination of anti-PD-1 and anti-CTLA-4 drugs. So since that time, we've recognized that, we have not been checking EKGs consistently for patients on immunotherapy because this was not an adverse event that was on our radar screen. However, there's a lot of important ways that you can work up a patient if you're concerned that they may potentially have a cardiac myositis. First, make sure you recall that these patients can present in a variety of different ways. There was a case report recently of a patient with myocarditis whose only presenting symptom was nausea. For the 2 patients reported in the New England Journal case reports, one did have atypical chest pain and shortness of breath, but the other had fatigue and myalgia. So you're not necessarily going to have a patient who's coming in with that very classic crushing chest pain that would absolutely lead you in this direction. So keep that on your radar screen. And then if you are worried that a patient may potentially have a cardiac myositis, you're going to want to send blood to check for a troponin level, which you would expect to be elevated, and a CKMB, which you would also expect to be elevated. You may or may not see changes on the EKG, such as prolongation of the PR interval, but you absolutely should check an EKG. Another thing you can consider is checking a cardiac MRI, which you could use to evaluate for focal myocardial fibrosis or inflammation. And additionally, you should check an echocardiogram. The gold standard, of course, for diagnosing a cardiac myositis would be a cardiac catheterization to get tissue. That tissue specimen you would expect to be infiltrated heavily with T cells. Management of cardiac myocarditis is a difficult thing, or myositis, and you should absolutely be getting your cardiac consulting service involved very early. High-dose steroids are, of course, the key, as they are with most immune-related adverse events. And the outcomes thus far have been quite variable. But these are the important steps that you should take if you're concerned that one of your patients might have a cardiac myositis.